exactly. It's it, see it's a slideshow? And then to advance the slides? I don't do that.
Good morning, everyone. Thank you, Professor Doshi, for giving me the opportunity to speak to my fellow classmates. Today, our topic is healthcare reform in America. It's a quality change for America. What is healthcare quality? What it means is that according to Institute of Medicine, healthcare quality is the degree to which healthcare services for individuals and population increases the likelihood of desired healthcare outcomes, and consistent with the current professional growth. What's iron triangle? Iron triangle deals with the cost, quality, and access. It must be balanced to have an optimum healthcare goal, healthcare reform. Quality, as you can see, quality consists of two categories. One is microwave and macrowave. Insurance is considered one of the biggest stakeholders in the current healthcare reform. In addition to the consumer and insurance and consumer are the biggest stakeholder in the current healthcare industry. Insurance has the biggest monopoly. Like for instance, if I go to a doctor's office or I go to a healthcare facility, the first thing I'm asking is, what's your insurance? So it shows the degree of the necessity, how one must use the insurance to get the proper quality healthcare one needs. Pre-existing condition and insurance dropping is another dilemma that insurance that average Americans are facing in the current healthcare crisis. For instance, if a person has a chronic illness, more than likely insurance won't take that person on to the won't give that person a good insurance, and more than likely that person will be refused to get insurance. And in addition to that, healthcare is dropping. If you have a, for instance, you are diagnosed with the, for instance, liver cirrhosis, more than likely you will get they will drop the insurance from you, and which is that the average American would suffer. Majority is good. Even though, however, most of the American most of the American thinks that healthcare is good. However, I don't agree with it. As a healthcare professional, we need to have the Obama administration that is going to implement the new healthcare reform. It is going to help average American to get a proper healthcare reform. And also 14%, like you can see in slide, 14% still thinks that quality of our healthcare is poor. So it shows that there are still people who thinks that there is a need for a change. What's our responsibility? Be active. For exercise. and have a balanced diet is the key things that will help us to get a quality healthcare reform that America deserves. For instance, child obesity is one of the epidemic that American schools and parents are facing nowadays. So we need to tackle that. Quit smoking and abusing alcohol will also help. I myself personally was used to smoke Marlboro Menthol Light, and after I saw one newscaster on Channel 7 or so, and he turned around and he died at age 63. So that day I said, you know what, I have to quit smoking. And thank God, it's been like 3 years that I'm smoke free. And at this moment, I'd like to take on any questions, and if anybody has any.
I have a question. I have two questions. One, going back to the second slide, can you describe the micro view and the macro view quality?
That's a good question. Macro view, it tackles system-wide effectiveness and outcome which include cost, access, and population. And micro view, it encompasses the clinical aspect of care delivery and the interpersonal aspect of care delivery and a quality of life.
Nice. So one other question, can you describe to me, so the slide with why healthcare reform is necessary with insurance monopoly, no, I'm sorry, not that, the last slide, our responsibility?
This is the last.
Yeah, how does that contribute to healthcare reform?
That's another good question. I'd like to encourage everybody to ask questions, in addition to the professor. The reason why that it is our responsibility. The reason why I said it's our responsibility that if we never before seen in the history of United States that you would see so many gyms centered around our neighborhoods. Like 2 decades ago, a lot of gyms that exist now, they weren't there. Mm-hmm. So it shows that thank God, thanks to the media, thanks to the healthcare reform, that that now people are worried about what they eat. Back in the day, everybody used to love McDonald's. And still they do. And we have a movie, a documentary, a Big Mac meat. So it shows that after that movie came out, McDonald's stopped selling that Big Mac meat. They gave it another name, and which is a fast food restaurant, and it's affecting our health. And if anybody has a chance to look at that movie, it will show you how from being a healthy person, how your health would deteriorate. And so it shows that yes, of course, even though we can't ask our government to do everything for ourselves. A lot of times a lot of times you say, oh, what you gonna do for me? No, what we can do. It's not what we can do for ourselves. Let's start from your own house, your own family. So,
again, but how does that influence reform?
Reform, the reason why it's influence, if you have a good healthcare, if you have a good health, it's gonna cut down the budget that the government is gonna spend on average American.
So you're saying if people are healthier?
If people are healthy, they would be less likely to go to the hospital, and the government would have more of a surplus to spend on a bigger population that we need. Is that answer your question, Professor?
Yes.
Anybody else?